social media has made GLP-1 look like a shortcut.
GLP-1 is the new weight loss magic drug everyone is talking about. We are seeing celebrity transformations everywhere. People are obsessing over it on social media. But is the hype actually real?
And also the trials have shown that the weight loss is about 10 to 22% of the original weight.
See, when you are overweight, obese, people always relate it to you must be eating more, you are not exercising, you're not doing it right. It is not always that. It is beyond your discipline and laziness.
No one can just go buy the medicine and take it by themselves. It needs a holistic approach. It needs an in-depth.
Hi, I'm Rajita. If you think about weight loss today, GLP-1 is the buzzword. We are seeing celebrity transformations everywhere. Some of them are amazing, some of them questionable. These celebrity transformations have taken over social media. And if you look closely, there is also a lot of confusion about GLP-1. How does it work? Who needs it? And some of them are even wondering if they can take it off the shelves. Today at Oliva Clinics, we have an expert panel to tell us exactly everything we need to know about GLP, the reality, the science behind it, and who is it exactly for. Joining us is Dr. Lakshmi Godavarti, general physician and expert in obesity, lifestyle disorders, and GLP-1 medicine. Welcome, doctor.
Hello, Rajita.
Hi. We have Dr. Rekha Singh, the chief medical officer at Oliva Skin, Hair and Body Clinic.
Hi, Rajita.
Hi. And we have Mrinal Pandit, head nutritionist at Oliva.
Hello.
Without any further delay, let's get started. My first question is to Dr. Lakshmi. I think GLP-1 really became the mainstream in India after we saw a lot of celebrity transformations. And that conversation suddenly also turned to criticism because we were seeing different kinds of results. So I was thinking, are we solving a problem or are we creating a problem? If you can throw some light on it, Doctor.
So definitely we are solving a problem. So today here we are here to discuss about the two new weight loss molecules, which are the talk of the. One is tirzepatide, which is famously known as Mounjaro, and the second is semaglutide, which is famously known as Ozempic. So these have to be given on injections on a weekly basis. So before discussing in detail about these injections, let us first know what is obesity. So obesity is defined as a body mass index BMI greater than 30. So it is calculated on the basis of height and weight. So it is a very complex multifactorial disorder. Why I say multifactorial? Because it may be genetic, it may be due to the bad lifestyle, or it may be because of the hormone dysregulation happening in the body, or it may be a combination of all the above. So there is a chronic state of inflammation happening in our body, which will lead to a silent internal damage if you do not control it. So, and it is also, obesity is also involving multiple systems. So it involves the gut, the brain, and the pancreas. Gut is where we get the hormones from, and the brain is the appetite or the hunger center, and pancreas releases the insulin. And this obesity is increasing day by day. What with our lifestyle, fast-paced lifestyle, unable to exercise, the wrong diet, eating more outside, and eating the unhealthy food, lack of sleep, and also stress. And presently, the estimated population of obesity in India is around 8%. The overweight are the percentage of overweight is 30% number, but globally it is definitely much more. So before that, I need to discuss the natural hormone cycle. So whenever we eat, our gut releases the natural hormones, okay, mainly our intestine. These hormones are GLP-1 and GI.
Okay.
Yes. So they aid in the digestion, especially of the fat and the carbohydrate metabolism. So they act as a bridge between the gut, the brain, and the pancreas. So that is how the metabolism happens. So, and what is the role of these natural hormones? They act on the brain they decrease the appetite, they increase the satiety or fullness, they enhance the insulin secretion from the pancreas, and the last but not the least, they delay the emptying of the gastric contents into the intestine. So by doing all these, the hormones are aiding the digestion, which appear. So these molecules mimic the natural hormones. The molecules which are talking about mimic the natural hormones.
Among people who have difficulty in producing the hormone.
No, it's not about that. The hormones will be produced, but the hormonal effect may be blunted by bad lifestyle, the bad diet, and the lack of exercise, and so many other factors. So normally these hormones rapidly deteriorate within our system within few minutes. But what these injections do, they give a sustained response because we are giving weekly ones. So they give a sustained response of this metabolic improvement. So this is how it acts. And that is why we have to start with a low dose injectable once a week, and then we progress every month and we increase the dose slowly.
From what I understand, doctor, is that GLP helps people suffering with obesity to lose weight and become their healthier selves. Now maybe Mrinal can throw some light on this, because there are several different ways of losing weight. How is GLP-1 different? What is it? What is the extra element that GLP-1 is giving people who are suffering with, who are finding it difficult to lose weight?
See, when you are overweight, obese, people always relate it to you must be eating more, you are not exercising, you're not doing it right. It is not always that. It is beyond your discipline and laziness, right? It is beyond your willpower. It is not just what you're eating. It is something called as food noise.
Okay.
It's a mental chatter in your head continuously going in loop, saying that I want to eat something. Once you finish, should I eat that?
Yes.
Most of us, but for few, it would be for a limited period. But there are a group of people where it does not stop, and it can be terrifying.
Yes.
So when you take this GLP, what it does, it works on the hunger center, and it quietens the noise. So imagine there's no noise, and you can actually for the first time start working or start doing things what are right. You can work on your lifestyle, you can work on what to eat mindfully. So for a specific group of people, yes, it is helpful.
Okay. So you are saying that it helps, it provides a small window of sorts.
Correct. So we can call it as a golden window. Okay. So a real physiological window where you get an opportunity, the sound quietens, and you get an opportunity to work.
Okay.
So that there's no trouble here, that continuous chatter is not there.
You can focus on...
Yes. And now you're not even hungry. So you just have to I have to eat, so I need to eat right. So that's an excellent way to deal with people who have that hedonic hunger.
So, Dr. Lakshmi, you've told us that, GLP-1 is great to tackle obesity. So, that is the target group. But who are the other target groups also who can, think about this drug? Who is it good for? Where can they start? If you can help us.
So there are certain indications. It is mainly indicated for those people with obesity who have a BMI greater than or equal to 30. This is the main indication. The second one being, even if a person is overweight, if the BMI is equal to or about 27, but with one complication which is related to the overweight.
Okay.
Like as I already mentioned, the metabolic, mechanical complications. So these two are the main indications. And it is very useful in persons or patients who are having not only obesity, but if they're having the associated medical conditions like diabetes, hypertension, heart problems, then it is even more useful, because this drug not only causes weight loss, but causes a lot of metabolic improvement.
Okay.
All the parameters of metabolism will improve. So much so that we make sometimes the adjustments in the medication of the patients. So it definitely improves the cardiovascular outcomes.
Okay.
and it is not like a quick fix. It has to be a permanent change in the attitude of the person, and to be coupled with the lifestyle measures. So these are the indications.
Okay. Like we see this, Dr. Rekha, if you can help us with this, there are a lot of people I see on the internet where they are like, I have 5 kgs or 4 kgs that I need to lose, and they are administering the drug themselves.
Yes.
So if there is so much medical supervision that is necessary, and there's a specific target group for whom this drug is I don't think this is safe. So how do you?
Yes, you are absolutely right, Rajita. So as a dermatologist, I also keep coming across so many clients who have PCOS, insulin resistance, whom we always want them to lose weight. But it sometimes gets difficult for them. You know, it's not only hunger pangs sometimes, though they are able to follow the right diet and exercise, there's something which is not helping them to lose weight, like it could be genetic disorders or genetic influences, rather I would call polycystic ovarian syndrome. So here GLP definitely comes to help, but as you said, it is not that easy. No one can just go buy the medicine and take it by themselves. It needs a holistic approach. It needs an in-depth analysis. So as a process at Oliva, we have introduced YouthShift program, which includes a 5-step we discover consultation process, wherein the dermatologist would look into the medical history in detail, understand what are the concerns of the client, why does this client need to lose weight, that is more important for us. Is it contributing to good health, good skin, good body contour, whatever, hair, etc. So then we take them through the medical history, look out for contraindications, whether they are really eligible to take the drug. We take them through the body composition analysis, which talks about the fat content, muscle content, what is their ideal weight, what is their visceral fat, all those facts we will get to know about this. Then they go through the derma scan, which is like a skin analysis. Then we take them through the trichoscan, which is scalp and hair analysis. And then comes the list of investigations, which are extremely important. Most of them do not understand this, and they think it is easy buying the medication. So here comes the catch. We have to take them through the battery of important tests, which will make us understand their in general health. Once the tests are done, they are then taken through the physician consultation. The physician would understand about their general medical health, how much dose to give, how to titrate, and she will also align them regarding what to expect once they start taking the drug. And then comes important thing, as Dr. Lakshmi very well said, only drug cannot do the magic. Our nutritionist role is extremely important, because these drugs just work on the hunger pangs or the satiety center, but they do not work on your muscle mass. They do. So don't expect those miracles to happen just with the drug. So their nutritionist consultation, which is a very important step of our We Discover program, plays a role, because they would understand their dietary history, what they like, what they dislike, what is their lifestyle, how much is the amount of protein. Maybe Mrinal can throw some more light on this. How much protein do they need? Because we have to preserve the muscle mass as well. Somebody loses weight, it is not just the number on the weighing scale. They're losing fat. They're also losing muscle mass. So we need to guide and protect the general health as well. So this nutritionist guidance is also there. So this is a very structured, integrated program. At every step, you have support in the form of a nutritionist consultation, dermatologist consultation, general skin, hair analysis, the body fat content, everything is taken care of. So it's not the easy cakewalk. It needs a good medical guidance and integrated approach. Hand-holding is needed throughout the journey.
So, doctor, does it mean, or because we are exposed to celebrities who have made the drug popular in India, some of them look absolutely stunning, some of them don't look as great, In fact, they look much older than their actual age. So, do you think that's a complication that can occur if it is not medically supervised, if you don't have expert assistance? Because looks like there needs to be a lot to be done in the background. It's not just you inject and then you go on with your life, right? So can you explain what are all the things that need to be done, and why do we see these differences in the results?
Yeah, certainly. because we see many people taking these drugs already. Some of them look fab and some of them look as if they have aged. The reason, you have already spelled out the answer, the assistance. I was talking to you about the muscle mass, change in the muscle mass or loss in the muscle mass, loss of fat in the unwanted areas. Somebody loses fat in the cheek, they are bound to look aged, they are bound to look gaunt. So there is the real crux. So there you need assistance in the form of a nutritionist guidance, a dermatologist who can preempt the changes even before they are seen. Like somebody is losing fat, I would rather step in and tell them that you need this, isn't it? So everybody wants to lose weight to look good. And if you are losing weight and not looking how you want, then the whole journey becomes, it should not become a rather a new problem. They shouldn't feel that it is a mistake from their side. So there you are. Some people look fab because they are definitely taking the assistance of a nutritionist, taking the right kind of protein diet so that their muscle mass is preserved. And they are also taking a dermatologist consultation and taking treatments, or I would say interventions, even before they start becoming evident to your naked eye. So that is how it helps. That's how you see some of them looking very good and some of them looking aged. I don't want to name this people who have already taken it. So again, we want people to feel young and look younger. They lose weight in a healthy manner, at the same time retain themselves rather than losing themselves.
Now that we've discussed about nutrition, if Mrinal can talk a little bit or tell us about, how difficult or easy does the drug make for people to have the nutrition that they need in a day? Because we were talking about protein and you said most of us, like, there's also this discussion that, Indians don't eat enough protein and our food is carb heavy. So how does YouthShift help in the nutrition aspect?
See, basically, if we want to lose weight, we don't want to lose weight only on the scale, right? We want to make sure that the weight loss is there, muscle is retained, our hair is retained, our skin is looking nice. We want to be fit and healthy. Because with the weight loss and the muscle loss, your immunity can also be compromised. You need to take all these things into consideration as well, right? So, and as I was earlier saying, the GLP works on the satiety. So, it will reduce your appetite. So, you get to eat only, you might not feel hungry at all. But just to nourish your body, you have to eat a smaller portion. So, right choice of food is important. So, even if you're eating little, what is there? Is it balanced? That is important. Now, I would always say, instead of going for a carbohydrate in the meal, which we are used to, we should focus more on the protein part. I was telling you about the breakfast part as well, that people eat a lot of carbohydrate and we don't focus on the protein. Ideally, we have to divide the protein for breakfast, lunch and in the equal amount so that we achieve it. Because if you try to eat all of protein together, it becomes really difficult, right? Indian population, if you're a non-vegetarian, we don't end up eating more than 40 grams of protein. That too, if you're eating meat at least 4 times a week, which we don't. Right?
I don't think anyone of us
No. So we have Tuesdays, Wednesdays, Fridays. That's the reason we don't eat it. So protein is a problem. And if you see vegetarians, trust me, it is not even more than 20 grams of protein. And when I try to tell clients that vegetarian is very difficult, people are the way, they don't eat soybean, they don't eat mushroom, so it gets even more difficult. And when I try to tell about the protein powder, like, no, let me go organic. See, protein powder is a very easy way to get proteins in the meal. So let's say if you don't have appetite, you're eating less and you try to eat, let's say, if you try to eat rice and dal, you get hardly 2 to 3 grams of protein. Let's say you're eating that, but you are taking 1 scoop of protein. Your protein, you have got 30 grams of protein. As an adult individual, a protein requirement is at least 1 gram per kg ideal body weight. So if you're 60 grams protein. And this is not for weight loss. This is for the wear and tear of the tissue, which you need to keep eating. And we are not there. Right? So when it's GLP, yes, it reduces the satiety, but you need to also work on the protein, which is very, very important. The nutrients, which are for your hair, for your skin, which is important. That's the reason we know what are the effects you will see if you are eating less for a very longer duration. So we make sure that the dietary pattern or the changes is as per the medicine, how it goes in the body. So first 1 to 4 weeks, we will make sure that body gets adapt to it, right? Because you might see mild GI distress, you might have nausea, you might have dehydration because you are not drinking water enough, or you might have mild vomiting. So for that, we make sure that the things which are readily available in the kitchen, what all can you eat, and can help you relieve those symptoms. Going forward in stage 2, this is a time where you are losing around 4 to 7% of your weight. So we want them to lose only fat and retain the muscle. So how do we understand what are you losing? Yes, the overall appearance gives you an idea, but BCA is the right way to understand how is your muscle going down. If it is dropping, early intervention would be necessary there. So I need to really focus on the protein and need to find alternative. If you're not eating this, what else can be given in the diet? Third phase, very important from the doctor's perspective, because here is a time where around 7 to 14% of total weight loss happens. So that's a rapid weight loss which you will be seeing, and this can lead to undernutrition. This will immediately affect your skin and hair. Where if doctor's intervention is there, as you were earlier mentioning, that will that be side effect? Why two people do not have the same results? That is because this stage is not taken very seriously.
So what kind of intervention do we do at Oliva for skin and hair, doctor?
So there, YouthShift program comes handy, and it is, as I earlier said, it's a very well structured program, because the story doesn't end with just taking the injections. It has to be consistent throughout the journey. So follow-ups are needed. As Mrinal said, you need muscle mass monitoring. You need, how to monitor how much fat you're losing, and the micronutrients part, which have a very important effect on your day-to-day routine. Somebody is losing weight but continuously tired, then that person cannot be happy, isn't it? And that shows up first on hair. Hair is like an accessory organ, I keep telling my clients. So anything that happens in the body, it first shows on hair. Oh, doctor, I changed the place, I'm losing hair. This is the common complaint. So even here, hair is the first one to get affected. And the third phase, as Mrinal mentioned, is extremely important, because there you are losing around 14% of weight. And that immediately shows on your hair. There could be change in the quality of hair, thinning of hair, dryness, fragility of the hair, and there's a lot of dehydration in the skin starts looking dull, there's no light reflection, and then you lose fat in the cheeks, abdomen, thighs, skin starts become lax, and that's how you were talking about, people looking gaunt and aged, and this is the main reason. So as a dermatologist, what do we do through our YouthShift program? Every month we do a follow-up, understand the changes, preempt the changes, and start interventions at the right time. I think that is what is being weaved into this program, which will help anybody who is taking GLP to make their journey smoother and get the complete benefit out of it. And also our physician who is going to, have a monthly follow-up, and she will make sure that the dose is titrated properly according to the tolerance and according to the results. If Dr. Lakshmi can add to the follow-up, what all do we do during the follow-up?
So we need regular follow-ups, and to know the response of the patient medication, and also to assess the side effects and monitor them, and also to monitor and adjust the medication dosages of the other associated conditions which you are dealing with. So definitely follow-ups are very important, and then only if everything is going on smoothly, then we go to the next dose. So as I told you, every month we keep on increasing the dosage gradually. So if the progress is good, if there are not many side effects, and all the other associated conditions are fine, then we progress to the next dose.
So the dosage is not something like, if I want to just see better results,
it cannot.
I go and take.
It cannot. It also depends on the tolerance.
Yes.
Like how good you are at tolerating that particular dose which the doctor prescribes.
So some people may not be able to tolerate the higher dosages. So then we can stick according to the lower dosages, provided we are getting the targeted weight loss.
Okay. So we have discussed the possible side effects that come with taking GLP. So we've talked about how the medical team will, predict and make sure that there's a prevention plan in place. So that is done. But there are certain over-exaggerated claims about GLP-1 in conversations that people have online. The first one, Dr. Lakshmi, is GLP-1 causes permanent organ damage. Is that true? Like, does it happen? Because then it's, I think,
No, it does not cause permanent damage. It only alters the metabolism in a positive way as long as the medication is in place. Once the medication is stopped, the patient may again get back the hunger pangs, cravings, and they may regain the weight, but not as much as the weight lost.
Okay.
So the trials say that the patients may gain maybe 50% of the weight loss,
Okay.
which has happened. But that definitely it will not cause any permanent damage, or it does not alter the metabolism permanently.
And I think if lifestyle changes are in place, then the weight regain also is limited. It is not as much.
Yeah, any drug has something called half-life. It stays in your body only for a certain amount of time. So after that, the drug is washed out. So it doesn't have a cumulative effect of. So that is not appropriate to say that it can cause organ damage, as Dr. Lakshmi very well explained to us.
Yes, yes. Okay. Some people think that they will just look 20 years older. We've already addressed this.
Yeah.
But that's again a myth. They're like, if I start taking this, then I'll not eat, and then I'll stress, and then I'll, look much older. So what is your, what is the fact behind that?
Losing weight is not looking young. There are so many other things that go with it. One is your general health, preserving the muscle mass, so that then nutrition comes into picture. Then there is something we have to take care about, hair, skin, body contour as well. You need to have the right kind of muscle mass. You have to preserve the fat. For example, face is made up of, bone, muscles. There are fat pads in the skin which give you that facial shape. So if you lose fat in the cheeks, that obviously is going to make you look aged or gaunt. So what do we do at that time? You understand what can go wrong even before it is seen. So probably I would, as a dermatologist, I would start them on certain skin hydrating treatments. I would concentrate on giving them a good skin care. There are many other aesthetic treatments that we do, like a radiofrequency tightening, whether it is on the arms, abdomen, or thighs. And then hair. Hair, as Mrinal has earlier said, it depends a lot on how much nutrition you are giving to it. And protein loss or not taking the right kind of protein will indirectly, results in hair shedding, hair thinning. So we may also suggest certain hair improvement treatments. It could be platelet-rich plasma therapy, or it could, there are many other set of treatments that we would give. And we also give the right kind of hair supplements, external applications, good hair care. So these are all again customized. One size doesn't fit all. So it has to be highly individualized, highly customized. So that there again the importance of follow-up, comes in. So that's how we handhold the client at every step, so that all these aspects are taken care of.
Yes, follow-up is both for the medical aspects and as well as the cosmetic aspects too.
Let me add one of our clients here. The client had come to us. He did not tell us that he was on GLP. He was only complaining about hair fall. And the hair fall was pluckable hair. And he was not even able to stand for a while. He used to stand and then all of a sudden he used to sit, like, I feel dizzy. So later we got to know that he had lost around 14 kgs in a month with this GLP over the counter. He did not consult a doctor. He never did his blood investigation. If in case he would have come to us and then we would have started the drug, probably we would have right away first, because she would have done a trichoscope, dermascan, everything. We would have started with the multivitamin for hair, the strengthening serum, everything could have started right away.
Yeah. So we could have prevented that.
100%.
No, imagine the plight. He must have been thinking about weight loss and now he loses hair.
Correct.
He must be definitely worried. What
So
am I
one
doing?
problem jumping into another.
Yeah.
So there we are creating more trouble for ourselves. And people also believe that GLP-1 is addictive. Is that?
No, absolutely no. It is not addictive. It just works on the satiety center. So that brain hunger center is there. It only blocks that. So you eat less. So that's the reason you get the weight loss. But once you stop, discontinue taking GLP under supervision again, yes, the hunger center is again open. It will again, you'll start feeling hungry and then you'll start eating. So what is important here is the lifestyle or the habits what you have made while you are on GLP alongside you taking GLP for 6 months. That is going to help you survive here. So you need to start building up habits of small habits like eating small and frequent, sleeping at a specific time, making sure that you're eating enough water, and physical activity. Minimum 5,000 steps. Minimum 5,000 steps per day is what is recommended.
I think. So, can you expand on what happens when the person goes off the, like when the treatment is complete? Like we've already touched, but if you can expand on it a little more, what happens when the course ends? Lifestyle changes happens, and if it's sustained, what can you expect?
See, if lifestyle, you are able to hold that same lifestyle, build a good lifestyle around your GLP, and you have discontinued the drug, you'll be able to maintain the results. The chances of rebound, weight coming back are very, very less. So what you need to do is, main thing even when you're in GLP, physical activity is very important, because what you eat needs to be burned. So that intake equal to output should always be there. So we need to make sure that the exercise thing keeps happening. And see, there are multiple things to it. So even if you do 10,000 steps, you're burning 350 calories. So that count should always be there. You're sleeping for 8 hours, you're burning 350 calories. So how beautiful is that? That's the only sedentary activity that is helping you burn calories. So this is how you build up the calorie loss, the calorie deficit, and you keep maintaining that weight. That's important. So lifestyle habits are very important.
So Mrinal, this question is for you. This current generation, we are chasing dopamine. Our lifestyles are very I think dopamine drives our lifestyle. And in India, for most of us, food is comfort, and food is also food is bonding, and food is also dopamine.
Correct.
So when somebody is on GLP and you're saying that it slightly brings down it cuts out the noise, it cuts out cravings, which means their intention or the excitement to have food probably also comes down. So when that is gone, where do we get our dopamine from?
Okay.
And yeah.
Okay. So yes, in India, food is celebrated, and food is comfort. Happy, eat.
Yes.
Sad, eat. Nothing to do, eat.
Yes.
I don't want to keep it in the refrigerator, eat.
Yes.
So basically we eat all the time.
Yeah.
So again, yes, dopamine is there. So let me tell you what dopamine exactly is. So it is a neurotransmitter. So basically it is called as a reward hormone, let's say. And what happens is, whenever you are someone appreciates,
Yes.
or let's say someone, you get more likes on Facebook, or you have more followers, the dopamine releases there, and our brain remembers that behavior. Oh, this was nice, it felt good, let's do it again. So this is the loop keeps happening. So let's say you are stressed, okay, and you eat a chocolate, so it gives you instant pleasure. Now brain remembers it felt nice, dopamine releases there.
Yeah.
Now brain knows comfort equal to chocolate. So every time now you are stressed, it will start craving for chocolate, and that emotional loop keeps happening. So now every time you are stressed, you would want to have a chocolate, right? So now with GLP, this dopamine is blocked, or we have that disconnect is there, right? But again, there are multiple other things. So we need to move that food release of dopamine to non-food things. And what is important, or the best thing what you can do, is do exercise. So when you do exercise, it releases endorphins. Those are happy hormones, and it can help you improve your dopamine. Right? Also, we've been talking about protein from the beginning. So in protein also, there's something called as amino acid, which is called as tyrosine.
Okay.
So if your dopamine is the chemical, so the building block is your tyrosine.
Okay.
So if you eat meat, chicken, poultry, or anything which is very rich in a complete amino acid profile, it will help you increase your dopamine, right? If you have to say about food, so I would always say omega-3 fatty acids. So omega-3 fatty acids helps reduce the inflammation, also increases the dopamine. So if you are a fish eater, 200 grams of fish per week will do wonders. If you are a vegetarian and still want to go on the fish oil pills, then we need to make sure that it should be mercury free, and it is microfilters. It should be away from all lids and toxins and everything, right? So omega-3 for sure, protein for sure, this will help you improve on your dopamine. And finally, vitamin D. So vitamin D is also very important, helps you improve your mood.
Yeah.
So what you need to do is, that's the reason even before considering even a single injection, we will make sure that the medical profile of the client has been done.
Yeah.
Not just done, corrected.
Yeah.
And we keep doing it for every quarter.
Apart from all of this, there is also a lot of fear mongering among people regarding this drug. So they are like, it's not very credible. What are the studies? Because like that's also probably because people have seen different kinds of results. So they're like, she must have done something extra, which is why she looks this or that kind of a thing. So Dr. Lakshmi, can you tell us like what amount of research has been done on GLP-1 and what all have we covered? So how safe is it scientifically?
Okay, so see, any drug is released into the market, lot of trials happen before that.
Yeah.
Like the phase 1, phase 2, phase 3 trials, and also the phase 4 trials which happen after the drug is released into the market, which is called post-marketing surveillance. So this medicine is approved by the two main regulatory bodies, the FDA and the EMA, which is the American and the European medical bodies. And this, a lot of clinical trials were done, for example, to name one step trial, Sermon trial, and many others. And they have shown that there is a consistent weight loss in these trials, and of course the minimum side effects. In the short term and medium term, they have established the trustworthiness and safetiness of these drugs. But of course, long term data, that is around 10 to 12 years, it is yet to come, and we have to wait for that. But they are, as of now, except for minimal GI side effects, they are safe. These trials were done on tens of thousands of patients over 2 to 5 years. So there is an adequate knowledge and research which has gone through.
So I definitely second with what Dr. Lakshmi says. Any drug which comes into the market comes with its own, learnings that we call. And we as Indians, or for that matter, any clients across the globe, when you take any drug for something else, there is always something brewing in your mind. But I would say that as long as you're taking these medications under able medical supervision, there's nothing to fear, because doctors know which dose to give, how to titrate the dose, how to make the client more comfortable with that particular dosage, what are the red flags that are seen, how to take care of them. I think if you are under the medical supervision, then you are in the safe hands to take this drug in your weight loss journey.
And also the trials have shown that the weight loss is about 10 to 22% of the original weight. Yes.
So imagine you are
22%
double
is
XL and all of a sudden you are M.
Yeah.
22% is a big number,
Yeah.
comparable to the weight loss which happens after bariatric surgery.
Okay, so 22% we can roughly say
I
double
mean, that is the
XL to
maximum. Yeah,
medium
but
size.
again, we need
double
to,
XL to medium. So
Imagine yourself, Rajita, you go to the shop and then you suddenly shop for smaller
yeah, I
goods.
think that is
That's
very,
a drop of 22 kgs. Right?
Yeah, so that's like quite, if for people who are finding it difficult to lose weight, I think it is a good, I mean, not good, great intervention. So Dr. Rekha, if you can tell us, for someone who's watching this and considering GLP, like we've discussed it, but once again, if you can reiterate and tell us, what is the right way to do it? Where do they start?
So the right way to do is, you go through a proper structured program. So as a process, I have already told you, you have to go through a proper medical consultation. So at Oliva, we have introduced YouthShift program, which includes a 5-step we discover process wherein you have a proper screening and consultation with a dermatologist. The dermatologist would take the necessary points in history as Dr. Lakshmi has listed, and we will understand what are the contraindications, whether you're really eligible for that drug. First step is to go through the body composition analysis, which talks about the fat percentage, the ideal weight, the muscle mass that you have, all those things. And then we take you through a derma scan, tricho scan to understand the baseline health of skin and hair.
Okay.
And then you have nutritionist consultation who would get into the diet history, their lifestyle and everything, and what they like, what they dislike. And then the set of blood tests, which are very, very important. That is why I was telling it is just not the off-the-counter drug.
Yes.
We have to give you certain battery, we have to take you through a battery of tests, which includes blood sugar, kidney tests, and sometimes in some rare cases, doctor would also ask you to check for retinoscopy and ultrasound as well. So once you get these tests done, your reports are ready, then you would go through a thorough physician consultation, and she would go through all the reports, and then according to the need, she will decide the dosage. And the dosage and how often should you titrate it. The follow-up schedules are very well done, and the nutritionist would be on call, or they would check the body composition analysis every 15 days to understand whether this is really working or not. And monthly once, dermatologist and physician do get in touch with the client to understand how they are behaving. And that's how we do it. In your journey, we make sure that the entire journey is done under proper supervision to get the benefits of this drug.
Okay, that brings us to the end of this podcast. Thank you so much for such an insightful session, ladies.